doing mobilization again of the lower part of the body. Again, you can do this mobilization with, even if you haven't got any problem, this mobilization will help a great deal just to keep things going. You know, because you have the hip joint moves in many different directions. What is called flexion, extension, abduction, adduction, internal rotation and external rotation, and then circumduction with the knee bent, clockwise and anti-clockwise. You also have traction and compression. Yeah? That way, if you do all these exercises, all this movement, again, when you go to Pilates or yoga or Tai Chi, these are the things that you're doing, but you're doing it actively. I'm doing it here passively. So I'm mobilizing. This will help a great deal for the lower back. So mobilization of the hip joint, you flexion extension, abduction, adduction, internal, external rotation. You can also do the circumduction with the leg straight, clockwise, anti-clockwise, or with the knee bent. Circumduction, clockwise and anti-clockwise. So sometimes you might have a little click which frees the joint, it just opens it up.
So a click is good?
Click sometimes is good, yeah. You don't want to do it too often, and that's what in osteopathy manipulation, you click it, what is called HVT, high velocity. So this is on the physical level, it's on the yang level. You open the body up. So when you use acupuncture, which works on the energy, it works better because you have opened up the body on the physical level. So when you put the needles in, the energy can move better because the physical body is less jammed. So again, flexion, extension of the hip joint, abduction, adduction, internal, external rotation, circumduction with the leg straight, clockwise, anti-clockwise, circumduction with the knee bent, clockwise, anti-clockwise, and then you're stretching it. You're stretching the spinal column. Like here, I'm using this side so you can see it. I'm opening up the gap in the sacroiliac and the lumbosacral area. You can work all the way up. And this will free the body from blockages. You can do the same thing with the knee, flexion, extension, circumduction, clockwise, anti-clockwise, or you can do figure of 8. You can do traction. Any joint, part of the body gets jammed up. Again, as I said, you can work on the viscera, what is called visceral osteopathy. You can work on the viscera, on the liver, gallbladder. You can again, as for asthma, you can work on the rib cage. Open everything up. Right.